welcome to this today's important patient-focused session organized and hosted by the Oncidium Foundation and the ICPO Foundation entitled Enhancing Global Access to RLT for Everyone. Before we start, let's say a few words about both organizations. As you know, the Oncidium Foundation is a non-profit organization recognized as a public benefit organization for more than 15 years, totally independent from any commercial activities. And our mission is to improve RLT through education, awareness, patient engagement, advocacy, and very importantly, our RLT Connect program that we have launched 2 years ago. It's a treatment donation program for underprivileged patients in countries where there is no reimbursement. So I'm very proud to share that in 2 years, this program is now fully operational in more than 20 countries. And last year, donation covered 1 cycle every 2 days. And this year, thanks to the increased commitment of our partners, it will be 2 cycles every 3 days that will be donated for underprivileged patients worldwide. Thank you. So since its launch, if we calculate in terms of value, it's been 3.5 million euros in value, treatment value that has been donated for those who cannot afford it. But looking ahead, we envision RLT Connect not only increase access to treatment donation programs, but also promoting the integration of RLT into national healthcare systems. At both foundations, we recognize that worldwide, there remain significant unmet needs in radiotheranostics. And addressing these gaps requires collaboration, education, and strong patient voice at the center of everything we do. And today's session is dedicated to that voice. We'll be hearing directly from people whose life has been profoundly affected by cancer. And before we start, I wish to thank our panelists of the day. Each of them bring a deep personal perspective. We will hear from Godfrey and Tiffen as a patient, but also from Alessia as a mother caregiver, and also from Dr. Tebazzo as a healthcare professional. We look forward to hear from your stories, and I hand over to Odile to present the ICPO Foundation.
So thank you, Rebecca. I'm first of all very happy to be here with you, with the panelists, and with the Theranostics community in this room in beautiful Cape Town. So before we start, both our foundations would like to thank the 8 TWC board for the special opportunity and also the trust given to us in setting this patient session. Thank you. Complementary foundation to Oncidium, the ICPO Foundation is on a mission to scale patient access globally through centers accreditation, certified education, as well as shared knowledge and clinical standards. The ICPO Centers network is collaborative and inclusive by nature, so driven by patient needs and outcomes. Co-hosting this patient session is at most meaningful for us. First, as we believe in building a strong collaborative team between patients and physicians. Second, as we believe in patient voice inclusivity across cancer care and also clinical research. In the name of both foundations, I wish you all in the audience an insightful session, shedding light on the reality of 4 insightful patient journeys, what Theranostics did for them, and their hope for the future, along with some messages for you in your quality of caregivers.
Let us move by introducing our panelists of the day. We will first meet Godfrey. Thank you very much for being with us today, Godfrey. You will share with us your journey since your prostate cancer has been diagnosed 4 years ago. Thank you very much for being with us. Then we will discuss with Alessia. thank you very much for being here. You are the mother of a strong and beautiful little boy called Stanton, who is 4 years old and who was diagnosed with a neuroblastoma at the age of 2. We had the chance, our team had the chance to meet him online through the numerous calls that we have preparing this session. And unfortunately, Stanton passed away a few weeks ago. But you insisted to be here, and we thank you for your courage to pass on the message today.
And I have the pleasure to introduce Dr. Tebatso Tebela, who is a nuclear medicine physician from Bloemfontein in a Universitas Academic Hospital here in South Africa. She pursued every possible avenue to make lutetium-177 PSMA therapy available through the RLT Connect program to those who could not access this treatment any other way. And I'm also here with Tiffaine. Tiffaine is joining us from France today. At 50 years old, she has been living with metastatic grade 2 small bowel neuroendocrine cancer for the past 9 years. Tiffaine has very kindly agreed to share her experience of not only living with cancer, but also of being active, informed partner in her decisions about the treatment. So Rebecca, let's kick off the panel.
Yeah. So, Godfrey, you are 61 years old and you live in South Africa. And, 62, I'm sorry. And in 2022, you were diagnosed with a prostate cancer through just a regular test with your GP. And since then, you underwent several heavy treatment, surgery, chemotherapy, radiotherapy, and also hormonotherapy. And you have developed severe side effects. Could you please share with us how these treatments impacted your life?
Good evening to everyone. It's a great honor to be a part of you today. I went for a chemotherapy, hormonal treatment, surgery, radiation therapy. After all that, but my PSA was going way up, which was a problem to me. It went up to 205, which is supposed to be 4. Yeah, I think 0 to 4. After I went all this treatment, I developed the side effects, breast development, swelling of my left leg, swelling of my left leg, only to find out was a lymph node because of this cancer. I think was starting to spread.
Yeah. So you've been through a lot with this, but then when your PSA level started raising up again, your urologist and oncologist offered you some new treatment. What happened next?
Yes, my oncologist, he prescribed some level of treatment. But my health insurance couldn't pay that. He said that was way up, was too expensive. Then my oncology decided to send me to Steve Biko hospital for this new treatment, which was and nuclear. But luckily I was positive. I never gave up. I went.
So your oncologist offered you a treatment that you couldn't afford because it was not reimbursed.
Yes.
And after that, this solution appeared that you could enter a clinical trial in South Africa here to start radioligand therapy. And then, how many cycles did you receive?
I received 4 cycles. Then my PSA went down. It was going down slowly. I can tell you now, from 205 to 0.057 is where it is at the moment. So good to that. Yeah.
And you were telling me earlier that when it was the time of the first injection, you were very weak, and your wife had to drive you to the treatment centers, and slowly but surely you start feeling better.
Yeah. As we are saying, on the first cycle, I couldn't drive. My leg was so big. I was feeling tired. On the second dose, she took me to hospital as well. But on the third one, I was able to drive myself and do all my daily activities. I'm doing my garden, I run marathons, you see. Really, it is a good medicine for all of us. Yeah.
So see, we are all happy, really happy to hear that. And Godfrey, when you entered this clinical trial, you told me that you never heard about these nuclear medicine therapies before. Yes. Were you scared? Were you clearly explained about this treatment?
Yes, I didn't hear about it, but after I've been selected to go to Steve Biko, then they explained me how it works. You see, then I was positive. I even know all the team of nuclear medicine. Even myself today, I take myself as a part of that family now. Yeah, I know everybody.
Thank you, Godfrey. Is there anything you would like to share with the health professional here today about your experience and the opportunity to access these treatments?
Thank you again. I'd like to share to the professional and to the doctors today. We are doing a wonderful job, really. Today I feel like a man because of your hard working. And yes, there is a little bit of a side effect. A dryness of mouth. Like now, can I take water a little bit? Just a sip. This is part of my life at the moment.
While you are drinking, I can share that your wife told me that you are now able to do wonderful gardening, and your garden is really beautiful, and you came back to a normal life. And even we would like to congratulate you on your marathon.
Yes, it's like that. I like gardening. My garden is so beautiful, you know. It's so beautiful. And I'm able to help washing dishes, cooking, drying, all those things, you see. Because I can see now I've got life. It's amazing. Yeah. And I'd like to thank the Prof. Sater. I don't know if he's here.
He's here. Professor Satege.
Yeah.
Mike is here.
Hi, Prof. Hi, Prof. Yeah. And his team. And they are amazing. They are good people. You see, just the reception, if you go into that that hospital, you cannot be hungry. If they say you've been there for a long time, they will offer you everything. You want coffee, they'll provide. You want some sandwiches, they'll provide. They are the amazing people. Even Cindy, I don't know if he's here. It's Cindy. Ah, Cindy. You see, if as men who are reluctant to go for checkups, I like to tell all the men out there, going for checkup, then you know your status. It's a very good thing. Today, I'm not scared to talk about a cancer. A cancer, they used to say cancer is incurable, but today I can see it's curable. Here I am. I'm a living example. I'm a living testimony. Here I am today. I'm a man. I feel like a man. I'm feeling strong. I think I can beat a lot of you here, especially with running. I can run.
Thank you very much. Thank you very much.
Thank you very much. Yeah.
Thank you. I will turn on you, Alessia. So I explained earlier the journey of Stanton, who was diagnosed at the age of 2 and who has been through a lot. And he received a lutetium dotatate through a clinical trial in South Africa called the LUDO trial that is supported by the Oncidium Foundation. And yeah, thank you for courage and for being with us and share this journey with greatest respect and care. Could you please, Alessia, tell us if it was easy to access this clinical trial, and how was the result with Stanton?
Good evening, everybody. It's an honor to be here today representing Stanton. I think you would have loved to be here because he was so excited. In December, when we still video called with the team here, so I'm here to represent Stanton. I'm his mother. So Stanton was the first child in Africa to receive the treatment in the clinical trial, and that was in February 2024. So the doctors came and said they have this, and with Stanton's situation that he was diagnosed with stage 4, it will really help a lot. So the first time he got it, we even excited because when the treatment came, it was the helicopters and they had to wait, and they said they can't come now, waiting for a helicopter. So it was quite excited to have this because we were also new with cancer, because childhood cancer is also new for us in the family, and he was diagnosed with neuroblastoma. So it was something new and something that we didn't understand, but like with us, the doctors, and they did explain to us very nicely, and so we could understand what we're dealing with. So when he got the treatment on the clinical trial, he received it very well. They sent us to the ICU, so just to observe, to make sure there's no reaction, no physical, no everything, but he received it well. And it was only one night in ICU, and then they sent us back home. And after that, he received the other treatments, the chemotherapy, and that the whole time, and after that he also got the radiation. So he received it quite well. Yes.
Yeah, and how was the quality of his life was improved? The quality of his life.
Yes, so the quality of his life, he was a real fighter. I have 2 other kids and they never knew why Stanton in the hospital, because once we were out, he was like playing like a normal child. He's never been laying down and you could see this, he's a sick child. The only way you could have seen there's something wrong is by the bald head. Because he didn't have hair, obviously the chemotherapy let the hair fall out. And he didn't even take notice because my father also have a bald head. So he's like, you have a bald head, I have a bald head. So that's the only, but otherwise the other 2 kids didn't know why we always in the hospital. But he really did. Most of the time it was up, but there was lots of ups and downs also. It was not just one patient around. Every month, now and then, you would get a fever. Like I said, you would need blood, you would need platelets, because maybe the platelets is low. You need to transfer blood every second month, because the chemotherapy obviously bring the immune system down. So that was also part of the journey. But like I said, he was a fighter and he was full of life. The other kids never knew what was wrong with him.
Thank you, Alessia. And looking back on Stanton's journey, what helped you remain strong throughout and beyond his experience?
So once you are diagnosed in the award that we are, it's a children's award. It's only children with cancer. So there's really a lot of support. There's caregivers, there's other mothers. So once you're being diagnosed, you're never alone. You don't feel alone. There's organizations, there's cupcake, there's CHOC. So it's Cupcake for Hope for children with cancer. Also CHOC is also a foundation. They give us accommodation. And it's like if you feel like you're too much, they will maybe send you and say you can relax, because being with a child that has cancer is also too much pressure, and you have other children that's also in school, so it plays a big role. When you have other mothers, then say, don't worry, we're here. And we also we God believers, so the faith of us, we never lost faith. So that was also one of the supporters, that we had people praying. We had other mothers, and the most important thing, the doctors is always there, the staff nurses. It's like we are one family, so you're never alone. With this cancer journey, there's so much supporters, and you will only see when you're there, if you're at home in your community, most of the people is not aware of the situation. But once you were your people in the ward, because it became home. The hospital became home because you have 4 days of chemotherapy, 5 days, then you come on weekends for 2 days. So you build a family. So the support structure was very good.
Thank you, Alessia. And I know you wanted to pass on a message to this community. So what is it? What is your message that you'd like to pass on to the community?
So I want to thank every doctor, every researcher, every trial that you're doing out there. It saves a lot of lives. Stanton was fighting, and he was cancer-free in last year, February, and then he was free for 6 months. So he had 18 months of living prior when he started diagnosed. So he did live a full 2 years after his diagnosed. And I want to thank each and everyone, because what you guys do is saving lives, is saving, especially someone like Stanton. He was just 2 when he was being diagnosed, and he didn't know what's going on. But like I said, the doctors is so nice, and all of you guys that contribute to what we experience with the children and even the adults, because I met a lot of adults during the radiation. So thank you to all of you guys. We appreciate it. Keep on doing what you're doing. We appreciate it out of our lives. Stanton is not here today, but there's other children that's still striving, that's still fighting. So a journey never ends. So once you diagnose, we still have the family at hospital. I'm personally still gonna go and visit, because like I said, we make family, we become a family. So what you guys are doing is saving lives, caring, extending lives. Unfortunately, Stanton had a relapse. So we passed a few weeks ago. So there's still children fighting the same fight. So keep on fighting and keep on doing the good that you're doing in the other children's life that's still fighting the fight of cancer. Thank you.
Thank you, Alessia, for your words and for your courage. We want you to know that we think of you and your family. I now turn to you, Dr. Tebatso. You are a nuclear medicine physician and also an ambassador of the Oncidium Foundation. And you highlight both the significant advances in RLT in South Africa and the ongoing challenges in rural and underserved community. Thank you for being with us today.
Thank you, Rebecca, and I'd like to pass my sincere thanks to both the foundations, the ICPO and the Oncidium Foundation, for arranging this very valuable patient-focused session. So I stand here representing one of our patients who should have been here, Mr. David Mochato, who was one of the first recipients of the Lutetium-177 PSMA through the RLT program. So sadly, he passed away also 2 weeks ago. He was very excited to come on this trip. Very excited to be leaving the Free State, getting on the plane and meeting everyone here. But regarding the connection that we create with patients, oftentimes due to workload or being too busy, we overlook the importance of creating meaningful relationships with our patients. And creating a good relationship with this particular patient resulted in an overall enhanced patient experience in delivering healthcare to him. We also saw that it improved his commitment and compliance to treatment. He was always present at all his appointments. He was also very much involved in the management program, and you will soon see that he was very optimistic about his overall outcome. Regarding the challenges experienced by patients in accessing treatment, where I'm from in the Free State, many of our patients come from the peripheries, very far off rural areas that are impoverished and disadvantaged, and areas that are ridden with poverty and unemployment. So our patients endure great challenges to be able to access healthcare. This can take anything from tapping into their very limited household income to pay for transport, long walks to reach the hospitals, sometimes spending nights in hospital dwellings to be able to catch very early the next day hospital transports from their villages to the city where they can access specialist care.
Thank you, Dr. Tebatso. So you created a special relationship with your patient, David. So unfortunately, he's not with us today, but I suggest that we watch his message through a video.
Nakalibiso ke David Mochato Mokoena ke sa Bethlehem botlhoko ke le dilemo di 65 ke phetse bophelo bonana bo bohloko bona ba cancer a fitla university se ke fitlhile university mona ke sa tsebo tsama ke tsama ka wheelchair no sena ntho ke nang ho nna no sena ntho a ke re ke nwa metsi a kgutla a ke re ke a ja di a kgutla no sena ntho ke nang ke tsama ka wheelchair walo ha khonu ke santwaneng a khonu etsa next university ya lwan san sana migana minga kapha migana ne bansela ona yo e matla khatla pele a ke thoma ba thoma ke tsa ntho una lo mo ne wa bantla ba ona kutlwe milona go ne ka tlhatso ke nna le tika o fela ke gambe fela ke tsetse ba ka mogana go isa fedising pele bo ma 7 to 10 minutes ke kutlwa ga khona ke nne no manai nga ke tsamadi togoma wa khatla bedi tsa tseke ya ka bona ona e petrolating ya ke mo ke khona o ja hantle mo ya no ano ke kwa ya se le tsantle wa na tshena ke khatla ba a khona ke a ikutlwa wa che wheelchair sa ba ke ya wa ke mo se khona ka ikisa bohle bo ba tlang ya teng sa tsinlena la ka jeno e ndinane tsa April ke toetsa treatment ya ka ya go katela le nya bone ke le wa spetlele ke le wa di doctor ke le wa botle ba no ba bile di thuso plaka ka bophelo baka moriane na ya tua ke a leboa Oncidium Foundation ke ska ba go nna fela wa batho botle e kenyel tsao se letsade ka mokgwatsi lena ke neng ka o ke a leboa.
So, Dr. Tebatso, looking ahead, what are your hopes for improving access to radioligand therapy in South Africa?
Rebecca, my hopes for improving RLT access in this country are threefold. The first being that organizations such as the Oncidium Foundation should receive financial backing and support so that they can facilitate access that, like they have done for this patient of ours and other patients who wouldn't ordinarily be able to do so. The second point is that I would like to see more multidisciplinary collaborations amongst healthcare professionals so that we can create suitable and streamlined treatment guidelines that we can get to the correct and accurate selection of patients with more benefit received from therapy. And then the last point, I would like to see more clinical research efforts, that we may see more radioligand options available for patients, especially those who are in need. Thank you.
Thank you, Dr. Tebatso.
Tiffen, let's talk about you. So first of all, thank you for participating in this patient session at the Theranostics World Congress, sharing your experience as a patient, but also as a patient advocate. So you're a mother of 2 teenagers, and you just turned 50-year-old. Happy birthday again. And you have worked in the video game industry as a communication leader for over 20 years. In 2016, you were diagnosed with a metastatic neuroendocrine tumor of the small bowel. Despite 2 surgeries in 2017 and 2020, and more than 135 injections of somatostatin analogs, you found out end of 2024 that your disease was still progressing. So my question is, what happened then? How did your doctor approach this situation with you? Or should I rather say and ask you, how did you, together with your doctor, look at the therapeutic choices?
Well, good morning or good evening, everyone. First of all, thank you very much to the foundation, both ICPO and Oncidium, for giving us a chance to share some messages with you. It's very important for us to be able to be on stage tonight and share some things with you. To come back to your question, when I got diagnosed 10 years ago, I had only one question to my oncologist, and the question was, what are the options now and in the future. Because I'm not a chess player, but I love being a step ahead. And so I wanted to know all the different options that were possible for me. And one of them was RLT. But at the time, 10 years ago, it was too early, given my situation. There were other treatments possible that were a bit less intrusive in some ways. And while I am 100% convinced about RLT, especially because it's a great innovation for NET cancer patients, I was not very excited back in 2024 when they offered me this treatment. And the reason why I was not very excited was because a few questions pop up in my head. The first one was, is it going to be the beginning of the end for me? Or will I have less opportunity in the future to get access to other therapy or better therapy like alpha therapy? Because I know about this, and I know that it's cooking and it looks great on the paper, but it's not yet available for everyone. So I discussed my fears with my oncologist. I discussed this also with nuclear medicine physicians. I even go abroad and talk to some specialists like Professor Baum. Hello, Mr. Baum. I had deep and honest conversation with everybody, and I understood a few things. The first thing I understood was that starting RLT earlier with a low tumor burden improves outcomes. But waiting for future innovations like alpha therapy while my disease is still progressing would consist in the loss of a significant opportunity. And last but not least, access to alpha, as you know, outside of clinical trials is not yet available, and it's not actually in France. So I made a decision, not a passive decision, a real decision with my oncologist to move forward and go for RLT. And I started Lutathera in January 2025. It lasted 8 months. And I ended up in July 2025. And I'm still here. Mm-hmm.
Thank you. And how did you actually feel after your radioligand therapy cycle? Was it up to the promise? And would you mind also sharing some results of your latest PET CT scan from earlier this month?
Well, you know, to be honest, I found this treatment super manageable. I was really surprised, actually. And I have to say that apart from surgery and all these monthly injections that I got in the past, and I still have actually, I had little to compare it with. But RLT was really manageable, more than what I expected. Yes, there is some fatigue, there is some nausea, there is a bit of loss of hair, following the day of the injection, but it's temporary, and you get back to normal after. I did face some complications 2.5 months after the last cure. Is it related to RLT? I am not 100% sure, but I have to share that with you. 2.5 months after, I had a bowel obstruction. It was very frightening. I had to go to the hospital for 10 days. They gave me some that's the word I've never known how to say, corticosteroids treatment, high dose, to manage the inflammation, and it worked pretty well, so I avoid surgery. I had that for 1.5 months, and then I stopped this treatment. And 6 days after, it came back. So I had a second bowel obstruction, and I had to go back to the hospital. And again, the same treatment, and I'm still on it. So not super, super cool. And I did some researches, because I'm part of the patient who looks to all the publications that you guys are writing. And I read some studies, notably by Strasbourg in the US, that says that there are some patients with peritoneal lesions, like me, when they get and when they have RLT, they can suffer from bowel obstructions. So the question I have for you guys, because you are all experts in this domain, is if you faced some patients like me who had bowel obstruction, I would love to know how you manage that, and if you know the optimal duration of the I can't say it, corticosteroid therapy. How long should I take that? So if you have any insight, please come to see me. Now, back to the question and the results, because it's been 6 months I have finished my RLT. I had the chance to do 3 big exams recently, very recently, right before going to South Africa. I had a PET scan, CT, PET scan, well, how do you say, PT, CT scan, whatever, PET scan. I had a MRI and I had a CT scan, and they all show no new lesions, no progression of the existing one, and even some shrinkage in my peritoneum lesion. So it was, for me, very, very cool, because I knew that this treatment was not going to cure me. From the beginning, I know it offers most of the time stability, and that's what I want. And to answer your question, yes, it has delivered exactly that, stability.
I'm happy for you. Thank you. However, when you were initially diagnosed, I remember you told me some first thoughts came to your mind, very hard ones, such as, this is the end of my life, I can never be cured, I will never become a grandmother, or I don't want to be seen as a cancer patient. So how did you progress from this initial shock to your mental strength today and your active role as a patient advocate?
When I got my diagnosis, my entire world collapsed. You hear the word cancer, and when you're not in this environment, medical environment, it echoes so much. It was a shock, and I think no one is equipped to face that type of challenge. But over time, with information, with support, I realized something very, very important. While I did not choose this disease, I can choose how I want to live with it, and that makes a big difference. And I choose to become an active patient. And by this, I mean get educated, follow research, follow clinical trials, learn about new tracers, new radioisotopes, new protocols, new even imaging strategies. And I think innovation in this world, which is theranostic, is not abstract for patients. It is hope with a scientific backbone.
Thank you. Since this session is being recorded and will benefit other patients, what do you wish to say to others, especially those recently diagnosed or hoping for disease slowdown or even cure?
Well, there are 3 things that I wish I could have heard 10 years ago. And I'm going to share that with you. The first one, and it's for the patient, but this disease is like a marathon. NET cancer is like a marathon in the majority of the case. It's not a sprint. There are phases of progression, phases of stability, sometimes regression. A bad scan doesn't mean the end of the world. A stable scan is victory. The second thing is research in nuclear medicine is booming. And you don't have to be part of this industry to realize that. There are articles popping up on the web all the time. If you talk with a patient association, you would hear also about beta therapy, alpha therapy, everything, all those radioisotope, those new combination, new strategy, the cocktail shot, all these type of things. And what will be presented during this Congress is not theoretical. It is shaping our survival curves. And last but not least, I would really encourage patients to ask and dare ask questions to their physicians. Not aggressively, don't worry, not confrontationally, but courageously. Find a physician who listens. Find a team that includes you in the decision. Because, you know, informed patients are not difficult patients. They are stronger patients.
Now, based on your interactions with clinicians during your own patient journey, as well as with the Theranostics key opinion leaders and researchers you met as a patient advocate, what are the key messages you would like to voice on behalf of patients?
So this is for you guys. Listen, because I have 5 very important messages for you. The first one is knowledge empowers patients and make them stronger, as I said. You know, many patients, they are actively looking for information everywhere. Maybe during their consultation with you, they are very silent and they are asking questions. But that doesn't mean that they are not looking for information. And it's better it comes from you than other people. So be clear, be transparent, and be personalized, because sometimes, yes, some patients don't want to hear things and they're not ready. But with time, they will get to that point. The second thing is honesty builds trust. In rare disease like neck cancer, there is rarely one perfect answer. And when you share your doubts, you build trust with your patients. Because humility invites partnership. And you know, my oncologist is not with us today, but she's expecting me to debrief her when I come back, because I'm going to learn a few things here, I guess. And she's humble enough to tell me, okay, just tell me what you learn, because she wants to improve as well. And that's, for me, exceptional. The third thing is every treatment has an emotional meaning. As I said earlier, I was not very happy to hear that I had to go through RLT 1 year ago, because I had this, even if I was convinced, I thought it was too early, and I really was expecting alpha therapy. So when you propose RLT or any kind of approach to your patient, understand what it represents for your patient, what emotionally it represents. Because it may symbolize hope, but it may symbolize the opposite. So please clarify that with this person.
Thank you, Tiffen.
No, I have 2 other messages. The fourth message is quality of life is not secondary, because stability, preserved autonomy is not a small success. For us, it's everything. And last but not least, my 5th message is see the person as a whole. We are not just metastatic case. We are parents, professionals, partners, maybe future grandparents or grandmother, like I wish one day. Patients are real. Patients think about risk-benefits ratios. Patients follow your publications, like me. And more patients want to be partners. It's the world we're living in, and Theranostics is one of the most exciting revolutions in oncology, I believe. And it will reach its full potential when scientific excellence is accompanied by genuine shared decision-making with the patient. So thank you very much. Thank you not only for developing these therapies, but for walking this journey with us. Thank you.
And thank you, Tiffaine, also on behalf of the community in this room, for sharing these 5 powerful takeaway message to the audience. Your journey and personality clearly illustrates the importance of being recognized as a genuine partner in all treatment decisions. Thank you. So Rebecca, I'm turning to you.
Yeah, so as we close this session, we want to thank the speakers for your openness and insight. And if I think about 3 takeaway messages, the stories shared today remind us that cancer cannot be a one-size-fits-all. And quality of life must remain a priority across both clinical trials and everyday care. And also that patients should be active partners of their care. Their voices guide better decisions, better pathways, and better outcomes.
So thank you again for our panelists for these invaluable perspectives, and to the organizers for creating this space where patient-centered voices lead the conversations. So I will hand over to the organizers and wish you, on behalf of the panel here, a very nice evening. Thank you.